I know you sit on, it seems like a number of boards of companies that you've invested in. How do you find the time to get your work done and sit on these boards?
Yeah. Well, the good news is, often I sit in an advisory capacity and not a fiduciary capacity. So there's other board members that deal with much more deep things that we do, but we do like to keep an eye on the work. The main piece is like ultimately these partnerships are vested in operations. And so I would say the people that are doing the most time intensive, most disciplined work are, the operating partners that own these relationships within our organization.
Mhm.
And I'm there to have broader context, broader support, share lessons learned from other types of efforts. But I think it's important to sit on boards simply because you get to hear and see and understand how these companies are really trying to impact society, trying to fulfill their missions, working with other systems. I mean, occasionally another system, solves something in a way we never could, and then that's a learning for us. In the health system world, especially today, it's very easy to stay fully internal. But the reality is it's, just like you're trying to serve your community, you can't do that just as the core operations of the hospital. I think just as you're leading a system,
Mhm.
you can't do that talking to your own people only. You have to really have this external point of view.